Hello all, I'm Professor Dragon Lish from the School of Public Health and Preventive Medicine, and welcome to this video in which we're going to cover all things related to Module 4 of the Evidence-Based Clinical Practice program, and we're going to have a slight focus on all things relating to clinical practice guidelines. So here are the objectives for Module 4. As I said, most of this module is focused on clinical practice guidelines. So the quiz and the discussion will have that as the central theme. So the first thing that I wanted to note is for Quiz 4, the final module, it will be mostly a critical appraisal of the first article from Module 1, so the MRC vitamin study. So I'd highly recommend that you all reread the article, have it open as you're doing the critical appraisal, as the majority of the quiz will be based on critically appraising that. The remaining questions within the last quiz will incorporate aspects that we've covered across all 4 modules this semester. So essentially it'll be a random selection for the remaining questions. So in terms of assisting you with a critical appraisal of the MRC article, we'll be using the following questions from the critical appraisal template that we focused on last year in terms of critically appraising this year's article on MRC. So again, feel free to do this beforehand if you find it easier. We'll have it open as you're doing the quiz. So the first aspect will focus on the methodology. So we're looking at the randomization of patients to the 2 groups, so folic acid versus multivitamins or placebo. So keep in mind things like selection bias, the impact of allocation concealment when answering these first 2 questions. The third question will look at the follow-up of patient, so identifying whether the follow-up was sufficiently long. I think it's fairly obvious there as it relates to the MRC study, but also complete, so regarding any particular dropouts. So moving on to the next aspect of the methodology. So in the previous question we talked about the duration of participants and the length of follow-up, so whether 6 months, 9 months, 12 months, whatever it may be, was sufficient. The next question, where all patients analysed to the groups to which they were randomised, is really looking at the dropouts, so whether or not participants dropped out, and if they did, were reasons given. So again, the focus of this particular question is around attrition bias. The next question, were patients, clinicians and study personnel kept blind to the treatment, relates to performance bias. And so depending on what the intervention may be, sometimes it's very easy to blind participants and study personnel to the treatment, and other times, let's say for a surgical intervention, it's not practical. So the final question here is asking, were the groups treated equally apart from the experimental treatment? So again, it's trying to gather that if we do see any difference between the 2 groups in terms of the results, we can be confident in attributing that difference due to the fact that one group received the experimental treatment and the other group did not. The final thing to look out for are the baseline characteristics. So hopefully if the randomization process has been done accordingly, we should see very few, if not any, differences between the 2 groups in terms of baseline characteristics. So the next aspect that we'll focus on will be the results, and so being able to interpret what the results were. So if they're reported as a relative risk, understanding the difference between a relative risk below 1, a relative risk above 1, and a relative risk of 1 and what that implies. And similarly for the confidence intervals. So whether or not the confidence include 1, how I guess wide or narrow the confidence intervals are, and the significance of identifying the precision of the confidence intervals. That is, identifying how wide or how narrow those confidence intervals are. So that'll be the quiz covered. For the group task or group/individual task, it'll be slightly different. So what we're going to ask you to do is critically appraise the clinical practice guideline on folic acid supplementation, which is reference 3. So again, all of these are freely available under the resources folder. And what we want to do is get you to appraise the clinical practice guideline using what is known as the Agree tool. So again, that's freely available as reference 2 under the resources folder. So the process, I guess, moving forward with the group task is to firstly individually assess or appraise the guidelines. Download the Excel spreadsheet that's available, put in your scores, and then what we want you to do is to upload that to your discussion group. From that, you'll then answer 2 questions, commenting on your scores and how they align or differ from your colleagues. So just a little bit about clinical practice guidelines. So hopefully you've all come across clinical practice guidelines to some extent thus far in your training, but essentially clinical practice guidelines try to I guess integrate the evidence that we've got and provide a relevant clinical recommendation. So it's trying to take on board evidence pragmatically in the clinical environment. So usually the process for establishing clinical practice guidelines is a group is formed, and that will consist of clinicians as well as academics, lay people and whatnot, who will determine the scope of the clinical practice guideline. A systematic review will be conducted, and from that the clinical practice guideline group will take that evidence and look at it from a practical or pragmatic view in terms of implementing it into practice. So this is what the Agree tool will look like, and hopefully you'll be able to download that and use it fairly easily. It's simply a series of 16 odd questions with a Likert scale of 1 to 4, in which you're basically doing a quick critical appraisal of the guidelines themselves. So here are, here's an example of what the Excel spreadsheet will look like, and I apologise, I thought it was 16 questions, but many more than that. Anyway, if it will only require one person to download the original Excel spreadsheet. If you can put your values in as appraiser 1 and then upload it, and then subsequent people can download that version and just add to it. And so hopefully within each group we'll have 12 to 15 people populating this Excel spreadsheet that everyone can see in terms of how they've scored the guideline and how they align or otherwise with their colleagues. So this is how the scoring is done. This is more just for your interest. You don't need to be able to calculate this. It's not going to be assessed or anything like that, and we've already done that for you in the Excel spreadsheet. But just to give you an idea of how that's calculated in terms of assessing the clinical practice guideline using the Agree tool. That's it for me. Hopefully you found this video useful. As always, if you need any extra information or got any questions, please feel free to email me at that address. Thank you.